Hello, my name is Ryan Gadd. I am a psychiatric mental health nurse practitioner graduate student at Azusa, and this is my physical health assessment. I would start by performing some hand hygiene, washing my hands, getting on some gloves, introduce myself. Hello, my name is Ryan. What's your name?
Rosa.
How'd you get here today?
I drove here.
And where are we?
At my house.
And what's the date today?
May 5th, 2024.
So the patient is alert and oriented to person, place, time, situation. She appears to be a middle adult female, well groomed, well nourished, with appropriate sexual development, proper posture. We'll move on with the HEENT inspection, starting with the head. Her hair appears coarse, scalp is not overtly dry or oily. Her eyebrows are thick, eyelashes are thick, eyelids, no apparent deformities there. Her nose and mouth are symmetrical, lips are pink and moist. Ears appear patent with no erythema, redness, or discharge to the ears either. The trachea appears midline. I'm going to go ahead and move on with palpation here. Let me know if anything feels tender. So no tenderness, no obvious signs of trauma, no alopecia. Go ahead and assess the brows, the sinuses. So frontal sinuses, maxillary sinuses, ethmoid sinus, lacrimal gland, and lacrimal puncti. No pain or tenderness noted there. I'm going to assess your temporal artery and TMJ. Can you open your jaw? Stick your jaw out and in, and side to side. No pain there?
No.
No pain, no crepitus. Go ahead and close your eyes. Those feels the same on each side?
Yeah.
Yeah. So cranial nerve 5 intact. Can you lift your eyebrows real high? Smile, frown. Cranial nerve 7 intact. Go ahead and assess the lymph nodes now. Anterior auricular, posterior auricular, tonsillar, submandibular, submental, supracervical, posterior cervical, occipital. And can you raise your shoulders up? Supraclavicular. No signs of adenopathy here. Keep your shoulders up. Try to fight me as I push them down. Good job. All right, I'm going to go ahead and move on with the eye exam. Do me a favor and read these numbers.
13587.
Patient is 20/20 on the Snellen chart. I'm going to move forward with a pupil exam, making sure the eyes are direct and consensual pupil response. Yeah, just look right at me. Very good. So pupils are equal, round, constricting from about 3 millimeters to 2 millimeters. Another exam here. If you look at the wall over there, and now focus on my finger. Keep your head still and follow my finger. All right. So cranial nerves 2, 3, 4, and 6 are intact. Go ahead and move on to the nose. Go ahead and look up. First, can you plug one nostril? Take a breath. Next nostril, take a breath. Very good. Look up. Septum is midline. Nasal mucosa is clear. Nasal passageways are clear. No apparent discharge present. I'm going to pretend this is an otoscope and there's a fresh piece of plastic on it. First, I'm going to tug the tragus. A little pull the tragus. No soreness there.
No.
So pulling on the tragus and the auricle on the left ear as well. No soreness.
No.
Okay. Like I said, this is an otoscope. Assess the tympanic membrane, which appears clear with a good cone of light in the right ear. Clear with a good cone of light in the left ear. I'm also going to assess hearing here real quick. If you wouldn't mind cover your right ear, I'm going to whisper something to you.
Cat.
Okay, and your left ear.
Dog.
Very good. I'm going to go ahead and move on to the mouth now. If you wouldn't mind, open your mouth. Stick your tongue out. So oral mucosa is pink and moist, along with the tongue. Tongue is midline. You say ah.
Ah.
Posterior pharynx and tonsils, no apparent erythema or redness. The teeth are intact, no braces or dentures or retainers or anything of that nature. I'm going to go ahead and use this tongue depressor. No apparent gum disease. Can you lift your tongue up? Wharton's ducts are present, and Stenson's ducts are present. Identifying the hard and soft palate. Okay. Actually going to test tongue strength as well. If you wouldn't mind opening. Try to push this blade to the left. There you go. And push the blade to the right. Very good. Real quick, if you swallow for me. Swallow one more time. Swallowing intact, no apparent thyroid tenderness. I'm going to go ahead and move on with the thorax and lung exam. If you wouldn't mind sitting here, kind of face the camera as best you can. Start with some percussion. Lung sounds are resonant to percussion bilaterally. Also going to assess for tenderness of the costal angle. Let me know if you feel any tenderness here. And CVA tenderness. None present. Take a nice big breath for me. Lung expansion appears to be symmetrical. I'm going to go ahead and listen to lung sounds. I'll start up in the apices down between the scapulae and into the right middle lobe. Each time this touches your back, just take a big breath. Bronchovesicular sounds here. Up in the apices, still bronchovesicular between the scapulae. And vesicular down in the right, middle, and lower lobe. Very good. I'm going to move to the front, check some breath sounds from the trachea, from the infracostallar breath sounds into the mid-chest. Tracheal breath sounds there. Bronchovesicular sounds there. And vesicular sounds here. Okay. Respiratory rate appears even, unlabored. AP diameter is 1 to 2 as expected. Normal shape, patient is not barrel chested. So we will move forward with the cardiac exam, if you wouldn't mind laying flat for me. So on initial inspection, assess the precardium, no bulges, heaves, or lifts, no apparent JVD. The PMI, no obvious pulsating there. I'm going to go ahead and palpate the PMI, fifth intercostal space, midclavicular line, which is present. I'll identify the 5 cardiac markers. We have the aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. And the mitral valve, fifth intercostal space, midclavicular line. I'll go ahead and listen to those with the bell as well. Right, regular rate and rhythm, no rubs, gallops, clicks. From here I'll move on to the abdominal assessment. Also start with inspection. No apparent aortic pulsations. As you said, no known skin infections,
No.
rashes. So skin is clear. We'll go ahead and listen for any abdominal aortic bruits. None present. While I'm at it, I'm going to palpate the carotid. Listen for any bruits here. Bruise present there. I'm going to listen for bowel sounds in all 4 quadrants. Bowel sounds present in all 4 quadrants. We'll start with a little percussion. Let me know if there's any pain.
No.
Okay, some light palpation. Let me know if there's any pain. A little deeper palpation. Let me know if there's any pain. Okay. While you're laying flat, I'll go ahead and move on to musculoskeletal. Beginning with inspection. Does not appear to be any edema, varicosities, or peripheral vascular issues. No redness, erythema. No swollen or achy joints.
No.
No. We'll start with some range of motion of the ankles here. No crepitus or pain. Can you fight your toes up and push them down and squeeze your legs and open them? Very good. You wiggle your toes. Very good. Assess your knee strength here. No crepitus, no pain.
No.
Okay, kick your knees up and pull them down. Very good. Same thing here. Assess range of motion there. Very good. Do me a favor, kick your knees up and down. Very good. No pain.
No.
Assess range of motion of your hips here. Very good. No crepitus, no pain.
No.
Good. No crepitus, no pain there as well. Alright. Palpate your pulses here. Dorsalis pedis present. Posterior tibialis present. Femoral pulses present. Radial pulses present. This was popliteal pulses present. And brachial pulses present. Go ahead and sit up for me. Yep. Yeah, put your arms out to your side, up above your head. Good. You scratch your back. There you go. No tenderness, soreness in the shoulders here.
Mm-mm.
Okay. Can you wiggle all your fingers? Check your cap refill, which is brisk. Full range of motion in the fingers. Squeeze my fingers as hard as you can. Okay. Try to push my hands down. Try to pull my hands into you. Good job. See your elbows here. No pain, swelling in your elbow here.
No.
Try to do a curl. Very good. Try to push my hand down. Good. No redness, swelling noted here. Try to do a curl. Very good. Try to push my hand down. Very good. Wrist down, wrist up. Okay. Full range of motion in all the joints. Check your neck. Can you put your ear to your shoulder? Ear to the other shoulder? Ear to your chest? And can you look straight up? Very good. Go ahead and stand by the bedside here. So now check your gait. 1 foot in front of the other, heel to toe. That's good, and backwards. Very good. Side by side, can you close your eyes? Okay, negative Romberg test. If you wouldn't mind, lift one leg up and bend the left knee, crouch down. There you go. Same with the other leg. Very good. You put your hands out, palms up, close your eyes. I'm going to write a number here. Tell me what I wrote.
3.
Very good. And this one?
7.
Very good. Graphesthesia present. I'm going to assess your mentation here. 3 quick words. Rock, hat, bicycle. Can you repeat after me? Rock, hat, bicycle.
Rock, hat, bicycle.
Try to remember those. Repeat after me. The quick brown fox ran over the hill.
The quick brown fox ran over the hill.
Can you count backwards from 5?
5, 4, 3, 2, 1.
And what were the 3 words I asked you to remember?
Rock, hat, bicycle.
Very good. Patient's thought process is clear. Memory is intact. And I believe that completes my physical health assessment. Thank you for your time.